And CAP, Vice President Fain and UNLV, and of course the 7 candidates, but most importantly the 1.8 million members of SEIU who make this first issue forum of the 2008 election cycle possible. I'd like to introduce the Secretary-Treasurer of SEIU, the woman who's the highest-ranking person in the American labor movement, is the head of the Change to Win Federation, Anna Berger. And welcome all of the members of SEIU, nurses and public workers, janitors and home care workers who are here with us today. Quality, affordable health care. Quality, affordable health care for all Americans is an issue on every American's mind, and we are committed to make sure it's on every candidate's agenda. Pat Moore is a nurse. She works at the University Medical Center, which cares for half of the uninsured in Southern Nevada. She's just one of a million SEIU healthcare workers who too often treat the people who the system is failing. Pat talks of a 10-year-old child with diabetes whose family traveled to Nevada simply in search of a good job and a better life. Diabetes is normally an easily treatable disease, unless you cannot afford the regular $40 cost for insulin treatment. Her family tried to get by stretching the medicine out, but sadly for their son, the bet didn't work, and he was rushed to the ER in a coma. Thank God, after 3 days of intensive care at the hospital, he came out of the coma and he recovered. In the richest country on earth, a $40 bottle of insulin should not be the difference between a child's life and death. Healthcare in America is no longer just a moral issue, it's an economic issue as well. America cannot be the only industrialized nation on earth that asks its employers to put the price of healthcare on the cost of its products when all of its competitors around the world do not. It is not just a moral crisis, it's an economic crisis, an economic plan that will not work in a 21st century global economy. Business knows this, which is why the Business Roundtable, Fortune 500 companies, AT&T, Intel, Kelly Service, and Walmart, who will be joined on May 8th by many more, they're demanding a new healthcare system. The public now knows this. Polling in the 4 early primary states shows the cost of healthcare is the #1 pocketbook concern for voters of both parties. And a vast majority of Democrats and Republican voters believe everyone has a right to quality, affordable health care, and they want fundamental, not piecemeal change anymore. Governors now know this. Governor Schwarzenegger and Romney, Democrats Rendell and Blagojevich, have plans for all their citizens, as do senators like Ron Wyden. Policy leaders now know this. Groups as wide-ranging as the Center for American Progress and the insurance industry have proposed plans to call for coverage for all Americans. So what are we missing? Leadership. Leadership in Washington, D.C. And for the next president, here's the final point of our poll. Voters are saying they're not hearing from you enough about health care. And in a minute, we're going to start solving that problem together. The winds of change of healthcare are blowing. It's up to us, voters, to keep the pressure on. To ask questions, but more importantly, let's demand detailed answers about what they're going to do. America's future is not a matter of chance. It's a matter of choice. And every 4 years, our choices, voters' choices, really do matter. Thank you very much.